So now we will prepare our client. You can protect her clothes with a towel or a disposable paper napkin. Then we need to protect her hair. So that's what you will use the disposable cap for. Put her hair inside it. Then, if you've done this step with disposable gloves, change the gloves, as we will now proceed to work on the skin. So you need new gloves, as you have just touched the hair and the clothes of your client. So now we will disinfect the skin. You take some cotton and disinfecting solution for the skin. Thoroughly clean the lips and the area around the lips. In case your client had any makeup, remove the makeup before this step and then disinfect the skin after the makeup removal. Make sure there is no residue left, as you don't want to inject anything else than the hyaluron serum. Now examine the lips of your client. Check if there is any asymmetry. Are there any irregulations in the contour and in the volume? So here we can see that one side has a bit more volume on the upper lip, and the down lip, it's the same. So we will add more volume and correct the contour as well. There will be 3 main zones to inject. If you want to correct the border of the lips, the contour, you will inject into the border, the upper and the lower one. If you want to add more volume to the lips, the first method will be to inject simply in the middle of the lips. The second method will be to inject between the wet part of the lips and the lips themselves, just on the line where the two parts connect, as well on the lower and on the upper lip the same. So here I have my prepared Hyaluron Pen machine. The button, as you can see, is out, the amount is set, and we just have to fix the rotating little part so that it doesn't bother us and we don't accidentally rotate it. The filler is in the capsule until the end of the top, and we will be putting the capsule flat on the skin. This will be one of the most important parts of this course because the technique will be shown, which you will practically use all over the lips. So we will start with the upper lip volume. We will put some shots on one side of the lip, on the other side of the lip, and in the middle. Here I'm releasing the safety button and I'm pushing the shot button. Now we will proceed with the injections. So we will start with the middle. So we need a flat surface on the skin with the capsule. We need some support behind the skin. So pay attention how I am placing my finger in order to get this flat surface. We need as least as possible space between the capsule tip and the skin. Like this, there is not too much product loss. And I will zoom in. And as you can see, there is a small red dot, which is completely normal, which you should see and this will indicate a proper product insertion. And it will indicate that you have properly placed the capsule and there was not too much space. Normally you will have a little residue of the product on the tip, so that you will remove, and we have to reload the machine. So you will turn the machine to the starting position until the injection button and the safety button are both out, and we will reload the dose. I'm putting it on the minimum again. And in case there is any residue of the product left, you will remove it with a simple paper tissue. And let's continue. This will be the step before each shot. Again, flat on the surface between the wet part and the lip part. Removing the residue of the serum from the skin, reloading the machine, turning it to the starting position until the buttons pop out. And you can hear and feel that they are out, and we are reloading the dose. Again, some residue, we remove it so the tip is dry, and we continue with the next shot. This process might seem a bit complicated in the beginning, but you just have to develop a habit. And the more you do the treatment, the more you practice, the faster this habit will come to you. In the beginning, it's honestly quite confusing to which side do you have to turn the machine, how to properly place the capsule on the skin. But the more you do it, the faster you get it, and it becomes effortless. Now again, I'm turning the machine to the starting position until the buttons pop out. And I turn it to the other side in order to choose the amount of one shot. And here you can see there is a little dot of blood, which indicates that the injection was made properly, that the placement of the capsule was correct. To start, you can inject all the upper lip with the shots of around half of a centimeter or 5 millimeters apart. So basically the red dots will be 5 millimeters apart. After, if you want to add more volume, you can repeat the full process. You can even perform multiple shots at the same place. Just remember, it's better not to use more than 1 milliliter of the serum per treatment. So basically 1 milliliter for full treatment, for the upper and lower lip included. So here I will show you how the process is done. Again, we will be focusing on the machine here, how to use it, when to rotate it. So again, I push both buttons and we shoot. Then we can keep a couple of seconds the capsule on the skin so that the product stabilizes, and we recharge the machine. Step 1, turning the machine to the starting position. Step 2, defining the amount. Step 3, stabilizing the capsule on the skin. 4, safety button. 5, injection button. If you wish, you can write down these steps on a piece of paper and refer to them during the treatment when you are just starting out. In this way, you will perform the treatment faster. And again, the machine is recharged, the surface is clean, and we add the capsule on the line between the lips and the wet part. And we make an injection, we remove the residue of the product, and we repeat the process. 1. Starting position. 2. Defining the dose. 3. Removing the residue from the capsule tip, and so on.